Hello again to the Ask Dr. Pane segment. Today is a really good question. It's from a young woman, early 30s, who has lost a substantial amount of weight and wants to know what the options are for buttock enhancement, specifically if she's a good candidate for a lower body lift with rotational flaps into the buttocks. Now, this isn't one we've talked about a lot, but we probably should because this isn't a procedure you can get just anywhere, and with good reason. A lower body lift involves essentially a posterior tummy tuck, so the scars go around the top portion of the buttocks. Actually, they're made on the buttocks and the buttocks are pulled up. Now, the skin above, which is in the lower part of the flanks or the waist, is actually the top layer is taken off, and that tissue is used as a flap to essentially rotate down while you're pulling the buttocks up, and you close that with almost like a gull wing scar in the back. And what this does is it allows you to have your own tissue to augment the backside. It's not for everyone. It's almost exclusively done in people that have lost a substantial amount of weight and their backside is too deflated for the fat transfer procedure to work because they don't have enough fat, number one, relative to the skin looseness. The only other option to augment the buttocks in somebody like this that's reasonable is the buttock implants, which have their own set of issues. Now, the buttock flap procedure, as we'll call it, uses your own tissue. In experienced hands, has a very low complication rate. I'm not a big fan of doing that at the same time as a tummy tuck because when you get those two procedures combined, you can get into a longer operation and higher risk of problems. Usually people will start with a tummy tuck alone, get the front taken care of, and then they come back and do the posterior portion that I am describing. It doesn't have to be done that way in 100% of people, so the plan is always individualized by each person's needs and what their preferences are. But an excellent procedure, and again, not something that everyone will do. It's people that are a little more experienced with handling massive weight loss populations. Our practice does this procedure. It is a good procedure, and in the right person can produce very nice outcomes. So again, posterior body lift with buttock auto augmentation or the buttock rotational flap procedure. So you can learn more on the website, and if there's any other questions, feel free to send us a message, and we will talk to you next time.